345, Musculoskeletal System. The objectives for this week are to describe the location and function of the various joints in the body, incorporate health promotion concepts when performing an assessment of the musculoskeletal system, relate the name and function of each of the 12 cranial nerves to its assessment, and differentiate among the 3 types of neurological examinations. The musculoskeletal system consists of the body's bones, joints, and muscles. Its primary function is to provide support and movement. The musculoskeletal system also encases and protects vital inner organs, produces red blood cells, white blood cells, and platelets in the bone marrow, and stores essential minerals. Bone and cartilage are specialized forms of connective tissue. Bone is hard, rigid, and very dense. Bone cells are continually turning over and remodeling. The joint is the place of union of 2 or more bones. Joints are the functional units of the musculoskeletal system, allowing mobility. The 2 types of joints are non-synovial and synovial joints. In non-synovial joints, the bones are united by fibrous tissue or cartilage and are movable or only slightly movable. Synovial joints are freely movable because they have bones that are separated from one another and enclosed in a joint cavity, which is filled with lubricating synovial fluid. Other joints of the musculoskeletal system include the temporomandibular joint, shoulder, elbow, wrist, carpals, hip, knee, ankle, and foot. There are 3 types of muscles: skeletal, smooth, and cardiac. Skeletal muscles, also known as voluntary muscles, are attached to bone by a tendon. Humans have 5 cervical, 12 thoracic, 5 lumbar, 5 sacral, and 3 or 4 coccygeal vertebrae. Surface landmarks help orient you to the levels of the spine. And on your slide, you can see the different motions that we can make because of our joints. We have flexion, extension, abduction, adduction, pronation, supination, circumduction, inversion, eversion, rotation, protraction, retraction, elevation, and depression. At different developmental stages, changes in the musculoskeletal system occur. Bone grows rapidly during infancy and steadily during childhood. Rapid growth spurts occur during adolescence. Bone lengthening occurs at the epiphysis or growth plates. During pregnancy, the most characteristic posture change is progressive lordosis, which adjusts the center of the balance as the fetus grows. At age 40, loss of bone matrix occurs more rapidly than new bone growth. The net effect is the loss of bone density or osteoporosis. Although some degree of osteoporosis is nearly universal, it is more of a concern among women than men. Subjective assessments of the musculoskeletal system would include the following topics: joints, if there's any pain, swelling, stiffness, or limitation of movement. To obtain subjective data, you should also ask about muscle pain, cramps, weakness, bone pain, deformity, or trauma, activities of daily living, occupational hazards, and exercises. As far as bones, you would ask if you have any bone pain. Is the pain affected by movement? Do you have any deformity of bones or a joint? Is it due to an injury or trauma? Does it affect range of motion? You also need to assess functional ADLs. Do joint, muscle, or bone problems create any limits on your usual ADLs? Which ones? Bathing. Do you have trouble getting in and out of the tub or using faucets? Toileting. Do you have trouble urinating or moving bowels? Are you able to get on and off the toilet to wipe yourself? Dressing. Can you do buttons, zippers, fastening behind neck, pulling dress or sweater overhead, pull up pants, tie shoes, and can you get shoes that fit? As far as objective assessments of the musculoskeletal system, you need to assess each joint, noting the size and contour of the joint and inspecting the skin and tissue, noting color, swelling, and any masses or deformities. Palpate each joint for skin temperature, muscle quality, bone articulations, and condition of the joint capsule. Assess range of motion specific to the particular joints. Test the strength of the prime mover muscle groups for each joint. Be familiar with developmental milestones in children and keep a concise chart of the usual sequence of motor development handy so that you can refer to expected findings for children of various ages. During adolescence, kyphosis is common because of chronic poor posture. Additionally, scoliosis screening should be completed. During assessment of the musculoskeletal system, incorporate health promotion. For example, discuss ways to prevent osteoporosis, which is more common in women than in men, and more common in individuals of European descent. Emphasize specific measures related to diet, exercise, lifestyle, medical options, and supplements. So your checklists for your musculoskeletal exam include inspection of the size and contour of joints, skin color and characteristics, palpation of the joint area, which is skin, muscles, bony articulations, and joint capsules, range of motion, active and passive, if limitation is noted in active range of motion, and you need to measure the degree of movement in the joint. And you also would do muscle testing. This last slide is, again, just a sample charting for the musculoskeletal system. It includes both subjective and objective data and also an assessment.